Hello, I'm Dr. Eduardo Garcia from Dr. Mexico Dental Group in Tijuana, Mexico. One of the most common questions we hear is, am I too old for dental implants? The truth is that age alone rarely prevents someone from receiving dental implants. Every year, patients in their 60s, 70s, and even 80s successfully restore their smiles with modern implant treatment. What matters most is not your age, but your overall health, bone quality, and oral condition. Even if you have worn dentures for many years or have experienced bone loss, there may still be treatment options available. Advanced procedures such as bone grafting or full arch solutions like All-on-4 can help many patients qualify for treatment. Dental implants can improve chewing ability, comfort, confidence, and overall quality of life. The best way to determine whether you are a candidate is through a professional evaluation and a 3D CT scan. If you're considering dental implants and wondering whether age may be a factor, our team can help you understand your options and create a personalized treatment plan. FAQ questions. Is 70 too old for dental implants? No. Many patients in their 70s successfully receive dental implants and enjoy long-lasting results. Can an 80-year-old get dental implants? Yes, many healthy patients in their 80s are good candidates for implant treatment after proper evaluation. Do dental implants work for seniors? Dental implants can be an excellent solution for seniors seeking improved comfort, stability, and chewing function. What if I have bone loss? Bone loss does not automatically prevent dental implant treatment. Several advanced techniques may help restore eligibility. Are implants better than dentures for older adults? Many patients find implant-supported solutions more stable and comfortable than traditional removable dentures.